Welcome back to Virtual Call on Congress. I hope you all enjoyed the first panel and hearing from our leaders at the CDC, the DoD, NCI, and FDA. Hearing about all the great work they are doing is exactly why advocacy is important. Congress needs to hear from us about why these programs are important and what they mean to colorectal cancer patients, their loved ones, and even those who haven't even been impacted yet. So let's jump into our legislative deep dive with Molly McDonnell, our Director of Advocacy.
Hi, everyone. Thanks for sticking with us throughout all of this. And so like Aubrey said, we are going to jump in to our legislative deep dive and talk about the programs that we just heard so much about from, the folks who are the boots on the ground. So if we could go ahead and go to my next slide. And the next one after that. So we're going to talk a little bit about our agenda for today and what we're going to cover. So during the session, I want to start with providing just some background about how Congress actually makes funding decisions and what that looks like. Then I'll dig into a little bit more of what we're asking for and why, what our virtual Hill Day is going to look like, and what you can do to get involved. And then at the end, I just want to talk a little bit about what else Fight CRC is working on and some of the exciting things that we've got coming up. So if we could go ahead and go to my next slide. So let's talk about appropriations. It's one of those words that, is thrown around a lot in DC. It can sound a little intimidating or maybe confusing, but it's really pretty simple. So appropriations is just the process by which Congress makes decisions for how various government agencies and programs should be funded. It's a process that they go through every year, so it typically starts in February or March, and in a perfect world, it's completed over the summer in advance of the start of the fiscal year, which starts October 1st. Whether or not that always happens is another thing, but we don't have to go there now. So if you'll go ahead and go to my next slide. This is a basic overview of what that process looks like, and kind of how it works. So it starts with member requests. Basically, every member of Congress in both the House and the Senate has an opportunity to go on the record about programs that are priorities for them. So this usually takes the form of a letter that they'll send that outlines, what the program is, what it does, why it's important, and what funding level they think the program should receive. So members can send multiple letters, and of course, the more that members weigh in about a particular program, the more attention it's likely to get. The next step in the process is the Appropriations Committee. So there's an Appropriations Committee in both the House and the Senate, and it's made up essentially of a few dozen members whose job it is to actually write the 12 appropriations bills. And so those 12 bills cover various government agencies. So for example, there's one bill that covers agricultural programs. There's one that covers energy programs, healthcare programs, and so on. So it's the Appropriations Committee to actually write the bills and kind of do all the back and forth, reviewing the members' letters and what their priorities are. The next step is a House and Senate vote. So once the committees on both sides of the Capitol work through their process, the full House and Senate must vote on those bills. So that, again, allows all 435 members of the House and all 100 members of the Senate to approve or disapprove of those bills. And so once that process is complete, we go to what's called a conference committee. So because the House and the Senate both go through their own process, often their bills don't match up. And so basically they all have to get together in a room and hash out the differences between those bills. And so once that process is complete and they've all duked it out over the different programs and they've come to an agreement, then that agreement has to pass the House and Senate again, so then it could go to the president for signature and become law. So I wanted to lay that out just to make the point that one, this is a very long process, and one where there's multiple points when we can weigh in. But right now, we're at a really important point because we're right in between the member request and appropriations committee process. So we're just at the tail end of the deadline for when members can submit their requests to the appropriations committee. So this is a key time for us to weigh in to make sure that our voice is heard about our funding priorities. So if we could go to the next slide. So what are we asking for? You've obviously gotten a preview of this with our first panel, but I just want to go over quickly sort of the broad asks and then some key sort of decisions that we made around, why we asked for those numbers. So we are asking for $70 million for the CDC's colorectal cancer control program, $120 million for the Department of Defense's peer-reviewed cancer research program, and $44.68 billion for the National Institutes of Health, and $6.92 billion for the National Cancer Institute. Those are big numbers, and can be sort of difficult to wrap your head around. But so, we did have a process into why we picked those numbers. And so for the colorectal cancer control program, currently that program doesn't cover the entire country. So there are grantees that are throughout the country, but it's not scaled to reach all the communities that are in need. And so we worked with our advocacy partners and the CDC to come up with a number that we felt would allow the CDC to be able to spread that program nationally. And so, so 70 million was where we landed on that. So it's really important, for us to be able to back up what numbers we're asking for. Then in terms of the DoD, where we're asking for 120 million for the peer-reviewed cancer research program, that represents a $10 million increase over the funding level last year. So that is a consistent increase from the years before that will allow them to not only to continue to do the great work that they're doing, but also to hopefully expand on all of their good work that Dr. Kim Bark talked about. And finally, the numbers around NIH. So $44.68 billion for NIH and $6.92 billion for NCI. So these numbers were the result of a discussion among the entire patient community. So as in years past, we've gotten together with our partners in advocacy, both in the cancer space and beyond, to talk about what we need out of the NIH and their various institutes, and how we can come together to advocate for that. So it's worked really well in the past because we've been able to see significant increases year over year, and we can leverage the combined power of multiple different advocacy groups when we're all singing from the same song sheet. So these numbers, a $3 billion increase for NIH and a $500 million increase for NCI, are bold yet reasonable increases that, again, will allow the NIH to continue to do the good work that they're doing and also expand into other projects. So if we go to my next slide, please. So let's dig into each ask a little bit. So obviously, you've heard about the colorectal cancer control program from Dr. Lisa Richardson herself and all of the good work that it does. But let's just go over it again to make sure that everyone is comfortable. So the CRCCP seeks to increase screening among people ages 50 to 75, particularly in underserved communities. And so they work with state health departments, universities, tribal organizations to implement evidence-based programs that have been proven effective to increase colorectal cancer screening. So some of the things that they do are implementing a system to remind both medical professionals and patients that it's time for screening, making it easier for patients to get screened by providing transportation, childcare, extending clinic hours, simplifying paperwork, offering patient navigators, and also offering different screening modalities. So it's helping implement programs that can make people have easier access to colorectal cancer screening. And one really important part about this program is that it uses data to show its effectiveness. And that's another really important piece for us to think about as we go to Capitol Hill, is that the CDC has done a great job of looking at what the program has done so far and looking how it's been successful, so we can go to the Hill and say, this has been working, so let's increase funding so it can get into more communities. And so in terms of what you can see on the slide here, and maybe we can, make it big so everyone can see it, but there's a lot of information that you've received today already from Dr. Richardson and the rest of us folks. But in terms of, key takeaways, why is funding important? Why do we need to be advocating for these? These are some of the main points that I think are really important. So first being that the colorectal cancer control program has supported a number of different organizations towards increasing colorectal cancer screening, and they've served a million patients in the United States so far, which is incredible. And they've also been able to increase screening rates by 10.3% over the first 3 years of the program, which is a great accomplishment and something that, given additional funding, they'll only be able to continue to build on. And so, I think a good way to really sort of sum up this program is that it's about prevention, and colorectal cancer is rare in the sense that it is preventable if caught early. And so we need to make sure that we're taking the steps that we can to address this preventable disease. So if we can move on to my next slide. So our next ask is the $120 million for the peer-reviewed cancer research program. Again, CRCCP, another mouthful, funds innovative, high-impact medical research for cancer prevention, detection, treatment, and survivorship for 15 different cancers, including colorectal cancer. So I know we had a question about this in the last panel that Dr. Kim Bark addressed, but if you go to the CDMRP, Congressionally Directed Medical Research Program website, you may not see colorectal cancer right away because it's tucked within the peer-reviewed cancer research program and doesn't have its own separate line. So that's an important thing to note. And so PRCRP really focuses on areas of need and works to advance research that's underdeveloped in cancer. And another important piece of this is that it's really complementary to the work that NIH and NCI are doing. It's not duplicative. The two agencies work closely together, and where NIH may not be able to dig into the research as much, that's where DoD can come in. And so again, we need to make sure that that this program has consistent and robust funding so that researchers can continue to do the work they're doing and also expand into other areas. And another important thing to note is that colorectal cancer being on the list of eligible diseases is not guaranteed. And so that's another really important part of why we need to advocate on the Hill for its inclusion. And that was something that Dr. Kim Bark talked about as well, is that, I think her words were, if it wasn't for you, if it wasn't for advocates, we wouldn't be able to continue this program. And I think coming from someone who is so intimately involved in the program, that's a really strong statement of the importance of advocacy and why we need to raise our voices and make sure that our members of Congress understand that this is important. So we can go to my next slide. Okay, so NIH and NCI, $44.68 billion for National Institutes of Health and $6.92 billion for the National Cancer Institute. So again, as Dr. Mooney talked about, the NIH is sort of the umbrella. And so within the NIH, they have 27 different institutes, including the National Cancer Institute. And so the NIH really focuses on foundational research that forms the building blocks of life-saving treatments and cures. And NCI is that principal agency that's focusing on cancer research on everything from basic research to clinical trials. And so if we could just zoom in on this slide quickly, again, it's really important that we make sure that this research is continued. And as Dr. Mooney talked about, it takes decades of research to see some of these breakthroughs. And so if there's a year when all of a sudden there's a drop off in funding or NIH or NCI is not getting the funding that it needs, it can interrupt and slow that progress. And so, again, I know that we talk about these programs year after year, but I can't overemphasize. It's not because we're not being creative. It's because each year we have to continue to fight for them. And another just piece of this that I wanted to draw some attention to is if you look at this chart on the bottom, that's the funding level for colorectal cancer research at NCI. And as you can see over the past couple of years, it's been decreasing. And so that's another important reason why we need to make sure that we're keeping colorectal cancer on people's radars. There's a lot of other cancers out there that are vying for attention, and of course they're all, merit as much funding as they need. But we need to make sure that, we're continuing to talk about it and continuing to make sure that it's on the radars of our legislators and decision makers. So, next slide, please. So to that end, obviously in the past, Call on Congress has culminated in an in-person day when we are going to Capitol Hill, meeting with our members of Congress and their staff, sharing our story in person, and talking about the legislative and funding programs that we care about. Based on the current circumstances, we can't do that, but it doesn't mean that we can't still have an impact. So we have decided to transition to a virtual Hill Day and set a bold goal of sending 5,000 emails to Congress in support of research funding for colorectal cancer prevention and research. And so we'll talk a little bit in a second about how we're going to do that, but I do want to mention one thing that we've seen come up in the comments a little bit. We obviously can't ignore what's going on in the world today. Coronavirus is obviously the top of mind for most Americans and certainly members of Congress. There's a lot they're working on. There's a lot that they need to do. But at the same time, the work on the funding process continues. So, this is part of the reason why we're sending emails. We're not flooding their office with calls, but so that we're being mindful and respectful of the fact that they have other issues that they need to deal with, very pressing and serious issues. But also we're making sure that our voice is heard and registered, because the appropriations process has not been put on hold. It is continuing. So we're certainly mindful of everything else that's going on. And I think that we can still make a strong and respectful mark by sending these emails with the things that we care about. So if we can move to the next slide, I'll dig into a little bit more about what Virtual Hill Day will look like. So tomorrow morning, you should look out for an email in your inbox that's going to have all the instructions you need on how to take action. So we've made it really easy. We've already drafted the email. It includes all the numbers, all the acronyms, all the program names. There is a spot at the bottom where you can add your story. You can add a personal message if you're comfortable. But if not, you click go and we'll make sure that it gets to the right spot. So once you take action, once you click that button, it's really as easy as that, and you'll receive a confirmation email that you can either forward on to friends and family, or you can use the original email to forward on to help everyone else get involved too. 5,000 emails is a bold goal. We're going to need to expand our community in order to reach that. And so I think, again, it's something that it's not going to be a big burden for people. It takes a minute to do. And so now's the time to, reach out to your friends and family. I've heard some people call it their tribe, those people that support you and love you, to just take this one quick action to help us do something truly incredible. And so another piece of that is social media. We've all seen the power of social media, the things that it can do for good. And so this is a great opportunity to let people know that you've taken action. Share your story, post a strong arm selfie, post a picture of you, hitting the button and, sending that email. It's just a great way to continue to raise awareness and get people talking about this. Excuse me. And so make sure you tag at Fight CRC and use the hashtag #CONC2020 so that we can keep track of all that you're doing. And we obviously love to see your strong arm selfies and your pictures, and it'll just be a great way for all of us to connect, even though we're all in the comfort of our own homes. So next slide, please. So the next piece that I want to talk about is just what else we're working on at Fight CRC. So Call on Congress is an incredibly important event. It is our cornerstone advocacy event, but it's only a couple of days a year, and we are busy year-round, building relationships, advocating for policies, developing educational materials to help, make sure that we're doing everything we can to support the colorectal cancer community. And so I wanted to just give a snapshot on some of those other things that we're working on. So, of course, many of you will be familiar with the Removing Barriers to Colorectal Cancer Screening Act. That's something that we have advocated for during Call on Congress year after year. We have certainly not forgotten about it. We are continuing to work on it. And for those who are less familiar, this is essentially to address an issue in Medicare. So Medicare currently covers colonoscopies without any cost sharing or out-of-pocket costs as a preventative service. But if you are a Medicaid patient or Medicare patient, and you go in and receive a colonoscopy and a polyp is found and removed, it's recategorized as a different type of procedure, and so you can wake up with an out-of-pocket cost. That's obviously a big deterrent to colorectal cancer screening and not the way that we believe the law was intended to work. So we have been working on this issue for many years, but have made incredible progress this year. We have over 300 co-sponsors in the House, over 60 in the Senate, and as of today, the House has passed this bill twice, which is pretty incredible, and has shown really the bipartisan support for this common sense legislation. And so don't think that we've forgotten about this. You'll be hearing more about this in the coming months as we really ramp up to have the Senate hopefully take action and get this bill over the finish line. Another bill I wanted to talk about was the Clinical Treatment Act. So that's something that we've been working with several of our partner organizations on and would provide coverage for care costs associated with clinical trials for those on Medicaid. So this is another important piece to help increase access to clinical trials. Another piece of legislation that we've been working on is the Cancer Drug Parity Act. And this, again, we're working with a number of other organizations in the cancer space to ensure that oral chemotherapy is covered no less favorably than the way that IV chemo is covered. So this is really important because we're seeing more and more oral chemo drugs come onto the market, and we want to make sure that the decision is between you and your doctor, and not based off of what type of coverage you might have. And so a couple of other things that I want to touch on that we're always doing year round is, as I mentioned before, building partnerships. So it's really important that we're able to work with organizations across the cancer and other disease state. We, are able to lock arm in arm with them to advance policies that impact all patients, not just colorectal cancer patients. And so it's been a great way for us to do that, and also for us, if we support legislation that other groups are working on, then they also support us. So it's been a great way for us to get additional support for the colorectal cancer screening bill. And as I mentioned earlier, with our work with NIH and NCI, it's a great way for us to, really move these big policy initiatives. The other piece is that we've made a really big effort to make sure that we are at the table where key decisions are being made. And so that may be in Washington, D.C. or elsewhere, but we are establishing Fight CRC as a trusted voice and resource both for the colorectal cancer community. So we sit on a number of different panels and task forces within NCI, FDA, DOD, and others, so that we're amplifying your voice and making sure that when these big decisions are made, the voice of the colorectal cancer community is there. And finally, I want to talk a little bit about some of the work that we're doing at the state level. So Many of you are familiar with the state proclamations, and we have developed a toolkit each year that we send out to folks so that they can request their governor to declare March as Colorectal Cancer Awareness Month. So we've been incredibly successful with this. It's been a great way for advocates to get to know their governors and help to raise awareness at the state level around colorectal cancer. And so if we could go to my next slide, please. So this next piece is something that we are really, really excited about. Fight CRC has primarily been focused on advocacy at the federal level. That will absolutely continue, but we've realized that there's a lot of action happening on the state level. We have developed an incredible network of advocates across all 50 states that we can really leverage and who are active and ready to get involved. And so this year, we are launching the Catalyst State-by-State Advocacy Program. And so this is really a program that is dedicated to accelerating policy change around access to colorectal cancer screening. And so we are funding a number of states to implement primarily two different policy initiatives. So one is ensuring that folks have access to screening starting at 45 in accordance with American Cancer Society guidelines, and also that there's no out-of-pocket cost for a follow-up colonoscopy following a first-line colorectal cancer screening test such as a FIT, FOBT, or stool DNA. So these are two key issues that we're seeing start to percolate at the state level, and two things that we know are really important to the community. And so we're really excited to be able, with help from Exact Sciences, to be able to provide funding for coalitions at the state level to implement policy or legislative or regulatory change around these issues. And so we have already selected the 4 grantees, and in the coming week, we will announce them. We're super excited. We can't wait to tell you who they are and what they're working on. But ultimately, our hope is to scale this to all 50 states. Like I said, we have an incredible network, and we know that we can build this out so that states can be sharing best practices and sharing their experiences, and ultimately we can build a network and be involved in policy change across the United States. So we are incredibly excited about it, and you are going to hear more in the coming weeks. So again, Call on Congress is not the only time for advocacy. There's things that we can be doing all year round. So in the coming weeks and months, definitely keep an eye out, because we're going to be coming to you with more opportunities to be engaged. So that pretty much sums up my presentation for the day, but I know that we've got some questions, and I've got Aubrey here who's taking your questions from social media and email. So I'm happy to answer any additional questions.
Yes, thank you very much, Molly. That, from what we've been hearing online, it's been great feedback about how clear you were in your presentation. Very happy about it.
Thanks, guys.
And so we got a few questions, and some questions that I actually have. I know that you're a very experienced person when it comes to being on the Hill, getting engaged with legislators, and also making sure that we have great partners in the things that we do. So I just wanted to ask if you can talk a little bit about how many advocacy partners, coalitions, that kind of thing that we are on as Fight CRC, and why it's important that we have those partners. I know you touched on it a little bit, but I want to make sure that we really shout out how that works and how important it is.
Yeah, absolutely. So it would take a lot of time for me to list out every single coalition that we sit on, but one that sticks out to me is the Cancer Leadership Council. So we work closely with them, and they represent a broad group of different cancer patient organizations. And we get together each month and really talk through what are the key issues that are facing the cancer community. Where are areas that we can come together to work on policy or to put out a statement to make sure that we're flagging things for Hill staff or the administration or other folks, so that they understand the voice of the cancer community. So that's incredibly important. We also work closely with a group called One Voice Against Cancer, and they are really focused on the appropriations process and funding. So we work closely with them as we develop our funding asks to, again, make sure that we're not the only voice on the Hill asking for these things, but that we can leverage the strength of multiple patient organizations and multiple communities to be able to really push things over the finish line. So it's a great way to be able to share resources and share experiences, and also to keep up with the latest policy issues that are facing the cancer community.
Definitely. I know that those partners are essential, so I just wanted to make sure that we really touch on that. We got another question to talk a little bit about forming relationships with policymakers and even staffers, and how important that is for people as they go forward, as they engage over the year, the next year, or following years on colorectal cancer policy.
Yeah, absolutely. So for those of you who don't know me, I spent a number of years as a staffer on Capitol Hill before coming to call on Congress. And so I can say it really makes a huge difference when you work to build a relationship with an office, and particularly with the staff. The staff are the gatekeeper to that member. And if you have a great relationship with them, you effectively have a great relationship with the member. And so again, as I've said before, advocacy is not just one day a year. And so obviously we are in a challenging time, challenging circumstances, but in a perfect world where we would be able to go up to the Hill, it's great to be able to meet them once a year, but then to continue to stay involved, email them as you see news about the member, or as you have questions about various policies that are coming up. It just is a great way to, make sure that you're staying on their radar, and that they're continuing to remember you and the colorectal cancer community as they are, going about their legislative work.
Definitely. Yeah, that is essential as well, just like our partners. We did get a question on where they can find all the details about the things that you spoke about.
I'm so glad you asked. So we really worked hard this year to put together really clear and hopefully helpful issue briefs around each of our asks. So if you're watching on our website, you should be able to go just below the live stream, and there's going to be links to our issue briefs, a fact sheet for colorectal cancer, and one other thing that I'm forgetting, but it's great. And so you'll be able to go over, it'll have all the things that I talked about earlier today about each of our asks, around the NIH and NCI, the peer-reviewed cancer research program, and the CDC's colorectal cancer control program. And one thing I really do want to highlight in those issue briefs is that we also included real-world testimonies from real people who have been impacted by these programs. And so I think it's a great way to, again, bring it home, and that these programs, really do touch actual people's lives, and they're more than just these big numbers and this alphabet soup of acronyms. And so I would really encourage you to take a look. And as always, we welcome your feedback on what's helpful and what's not. But I think they turned out really great. And shout out to Andrew Wortman, our community engagement manager, who is an incredible graphic designer and has made them look really, really beautiful. And I think really help sort of drive home what we're asking for.
That was great. Yes, definitely. You can, if you're not on our website, you can go to calloncongress.org, and you'll be redirected to this live stream and where those resources currently are housed. So I think one last question that we have with the time we have left is to talk, I know you touched on this just a bit, but I think that advocates are worried about over the next space of time, as COVID-19 and coronavirus is really affecting a lot of our daily lives. How can they get involved still with advocacy, and what can they do from home as they go forward in the next couple months?
Yeah, I think it's a great point. We're obviously a little bit in uncharted territory here, but I think it's going to be a really exciting way to show the power of social media and virtual engagement. So we, as I said, we've set this bold goal around 5,000 emails. I think it's a great way to get involved, both from the perspective of a lot of folks are at home right now, maybe trying to navigate working from home and all of those things. And also, members of Congress are hunkered down themselves. And so they'll still be working, but many of their staff are also working from home. And so they're looking for ways to engage that doesn't involve an in-person meeting. And even sometimes a phone call can now be difficult because a lot of staff will not be in the office to answer the phones. And so, sending an email is a great way to, still get engaged. And I think, if we can hit our goal of 5,000 emails, it'll be such a strong and powerful statement about, the resilience and the relentlessness of the colorectal cancer community, while still being mindful of the fact that there's other things going on in the world that are, of course, challenging and difficult.
Definitely. Thank you so much, Molly. I think this was really informative. I hope that everyone online that's viewing feels really well informed on our asks, our legislative priorities. And if you had some extra questions, we are out of time on this panel, but we will be sure to answer those online.